Well, meanwhile, some economists are formulating their own plans to get the country up and running again. Nobel laureate and NYU professor Paul Romer recently published what he believes is a viable roadmap to responsibly reopen America. Professor Romer joins me now. Professor, you argue that the U.S. has now got to shift to a plan that balances the need to protect our health, but also be able to reopen the economy by locking down really those who are just infected. You suggest something you've got to do is everyone's got to be tested, not once, but every 2 weeks until a vaccine is approved. And your endeavor will require 25 million tests per day. Is that really feasible? And how do you pay for something like this?
Look, it's entirely feasible. This country makes 350 million cans worth of soda every day. If we can make that much soda, we can make 20, 30 million tests a day. We just got to put our minds to it and do it. And we also have to provide the revenue, the resources to do it. We get that much soda because we spend 50 billion a year on soda. If we were willing to spend twice as much on soda, on tests as we spend on soda, about 100 billion a year, we could easily get to the numbers that we need of 20 to 25 million tests per day. And it's important to understand why we want those tests. This isn't to like check a box on some checklist to say we can open now. I mean, think about the workers in those meat plants, the meat packing plants. If everybody were being tested before they came in to the factory, everyone would know that they're not going to catch the virus from one of their colleagues. And think about why Vice President Pence could say it was safe for him to not wear a mask. He said, well, I get tested regularly and everybody around me gets tested regularly. Why don't we offer that to everybody? So we all know that all of us out and about on our jobs are not infecting each other.
You know, I recently spoke with Rockefeller Foundation President Raj Shah on this program, and his organization is rolling out a $100 billion national testing strategy. It's going to yield 30 million tests per week. Do you think that that group strategy serves as somewhat of a litmus test for what you're also envisioning?
Well, I worked closely with Raj and the people at the Rockefeller Foundation. Raj and I wrote an op-ed together outlining this vision. I wrote a separate report because I wanted to focus on the measure that I think is credible, that is understandable, that will work. Again, just think about why Vice President Pence says it's safe for him to be out and about not wearing a mask. It's really just repeating that at the scale we need for that to apply to everybody. The Rockefeller report addresses some other strategies that were worth trying, like investing in a health core that can trace the contacts of people who've tested positive. But I think we can't lose focus on the importance of testing and the freedom that it will give us to go back to life as we knew it. I think about recovery. The question, I think about it in terms of when am I going to get my teeth cleaned, right? I don't want to go see my dentist
Right.
until my dentist has got a test that says he's not negative. He doesn't want to see me until I've got a test that says I'm negative. So we just can't do the things we need to do until we have the tests that show that it's safe.
You know, over and over again, every day on the show, I keep hearing everyone from all walks of life who are experts like yourself saying it's about testing. We've got to test. Currently, the U.S. is testing an average of about 150,000 people daily. But you argue that the wrong people are being tested. You say you've got to also test the asymptomatic spreaders of the virus. Why do you believe that's so important, especially as it pertains to the plan that you're detailing?
Yeah, that's what makes this virus so dangerous. The SARS coronavirus 1, over 8 months, it only spread to about 8,000 people. It was no big deal because people were not infectious until after their symptoms showed up. This new one, number 2, is much more dangerous because people can infect each other before they show any symptoms. These asymptomatic spreaders are the dangerous people. And we've got analyses of things like the problems in nursing homes where they tried to focus on residents once they got a cough, once they got a fever. They were just always behind because the people had already infected each other before any of these symptoms showed up.
So as an economist, you're well aware of the challenges that this pandemic's created. What do you really see as the single biggest obstacle for the U.S. as a nation who's desperately trying to also restart the economy in the coming months? What are you looking out for?
The problem is going to be fear and a lack of confidence. Because just as I'm afraid to go to the dentist is afraid to have me come in. People will be afraid to go back to their jobs. They'll be afraid to restart their restaurants. If they're told, well, there's a chance we're going to go back into lockdown in a few months because we just really don't know if this is going to work, nobody's going to restart a business. Nobody's going to create a new business. Nobody's going to invest. So it isn't officials that are getting in the way of an economy. It's going to be fear and a lack of confidence that holds us back and keeps us in what could be very depressed economic conditions until something like a vaccine comes along that could restore confidence. I'm saying get the tests because that could do it reliably much quicker.
All right, Professor Romer, I want to thank you very much for joining us.